Hi, good day. I'm with Dr. Haley here. I'm interested in becoming a transplant surgeon, and Dr. Haley is going to. I'm sorry, Dr. Haley is going to be showing me around the hospital today and showing me some of his responsibilities and duties.
That is me. I am Dr. Haley. Drop my pencil. This doesn't happen normally. This is much more quiet. Can you move? Thanks.
So, Dr. Haley, I was wondering if you could tell me some of the responsibilities that you do with the hospital.
That's a great question. But I feel like I could show you more than I could tell you. So what we're gonna do is we're just gonna move down this hallway. This is the east wing of the hospital that I work in, Harvard. It's really great. I really recommend that you work here. It's really fantastic. Can you move, please? Really important.
We were just filming.
Don't mind people. I mean, they get in your way, but as a doctor, you need to work with people. So normally what we do is, I usually do rounds with patients, and that's our main responsibility. You have to make sure all the patients are good, they're healthy, their vital signs are good. So I have these charts, people's names in it. I go around and make sure to go to their beds, check off if things are good. I am right now. Vitals, wrong. Interns, not good at the job. Anyway, and our primary thing is surgery. I mean, we're a transplant surgeon for a reason. We do heart, we do lung, we do kidney, we do liver, you name it, we're all specialized. I personally do heart because it's the best organ in the body, but that's fine. You got it. Do you take notes on this? Yeah.
Yes,
That's what I
yeah.
thought. That's what I thought. Exactly. And that's pretty much the basic responsibilities.
So I know there's a. Oops, sorry. I know there's a lot of hours that you have to put into your work here. So on an average day, how many hours are you usually working?
You know what? That's another great question. I'm not going to answer that question because it's going to make you not want to do it. I work, 15 hours a day typically? I mean, it depends. It varies. I mean, it's pretty intense. Like, you have to be committed to this job in order for it to work. So you get what you get out of it. So depends if I have a surgery that day. If I have a surgery, that'll tend to be longer, 10, 15 hours, depending on the surgery. Heart surgery take a while. You have to wait for the donor to come, also put it inside the body, so.
I'm here with Mr. Haley in his office.
Yep.
Correct. Yeah.
Smart girl.
Mr. Haley, I was wondering, well, Dr. Haley, I'm sorry.
Exactly.
I was wondering if you could tell me some of the educational experience required to get to this point and certifications that you've gotten through this job.
Good. And we talked about this earlier, about how much it takes a day. So you can imagine if I'm sitting here as a surgeon, constantly checking on patients, making sure they're doing all right, working with other, physicians and nurses, as well as actually completing the surgeries. It's a lot of work. Requires a lot of education. So definitely undergraduate. I mean, obviously, you can't really go anywhere without an undergrad degree anywhere. Med school, and the training is intense. I had to do 5 years of residency as a surgeon, which is general, before I declared my specialty in cardiac surgery. Then I did a fellowship. I had 2 fellowships. I did one in cardiac surgery specifically, which was 2 years, and then another 2 years as a cardiothoracic, transplant surgeon. And you can always go back to do training, do fellowship. So I could go and do a liver one if I wanted to, or a lung transplant, which I've actually just completed in this past year. So it all just depends on what you want to do. You have to be good at what you do. You have to be educated, really know what you're doing in order to be the best. Which, us over here at Harvard really emphasize. But
We'll wait until you guys are done.
so the responsibilities are pretty intense. I mean, people's lives are on the line here, so you have to make sure you're on top of. We got a patient down. We got a patient down. I need nurses. I need a doctor. She has no pulse. She's not breathing. I need an intubation tray, a chest tube. Okay, we're done.
So, Dr. Haley, can you elaborate a little bit on what happened out there?
I mean, it's intense.
Is that a common situation?
It really isn't. Usually she's 27, she's had a heart transplant for congenital heart disease, and she was 3 days post-op, walking around when she probably should have been walking around. I did not prescribe that. She got to another doctor. So, I mean, as a transplant surgeon, you have to make sure that your patients are followed up even after they're done through surgery and after the vital signs, and make sure they're getting the appropriate treatment, even when they are, released. She wasn't released, but in general. But I mean, it's not uncommon, but it's not common. Because, I mean, people's lives are on the line. We're in charge of not only being a surgeon, but being the physicians. We have to save lives. We have to work on the forefront of trauma as well. So now I have to log that in the books. Hi, I am Cliff Haley. I'm another potential med student following around transplant surgeon. This is pretty exciting stuff. I'm fresh out of med school and I'm thinking about pursuing a career in this. But we'll see. So who are these people? Why are they here? Where are we right now?
We're in our hospital wing here. Here are some of our patients and
Hello.
doctors.
Are you okay,
They're
Miss?
acting with each other
She
and
seems
they're
healthy.
checking in. Yeah, she does seem pretty healthy.
Is that one of your patients?
That was one of my patients. She actually had a heart transplant surgery quite recently, and she's now recovering.
She is. Saving lives. Beautiful thing. So, there's a lot of rumors that y'all are like really rich. So how much do y'all typically make?
Well, myself make around $500,000 a year, but our salaries range from $100,000 to about $600,000.
So, you know, education-wise, I mean, you've been in school for who knows how many years.
Yes, it does take a lot of education, but if you're dedicated to your studies, you should be fine. I personally majored in biology in my undergraduate year, and then I went on to pursue med school. And now I'm practicing in the hospital as a transplant physician, and I specialize in heart surgeries.
Oh, that's excellent. How long did the training take? So I know you have to do an intern, resident, and then now you're attending. So how long did that process take?
It took a while, it took a couple of years. For
definitely.
me, it took about 3 years to do my residence and training on top of all my med school, and I also did a bunch of interning as well, of course. And my interest in this actually started as early as my high school years, and I did many things with like interning with my hospitals around my local area. But I would say if you're very interested in this is definitely a great career to pursue.
Awesome. So where are we going now?
Well, now we're actually I'm checking our patient, Miss Zane here. She had a lung transplant, and I'm just going to check on her and take her vitals and make sure she's doing all right. So, Miss Zane, how are we feeling today? Good. That's good. I'm going to go ahead and take some of your vitals real quick and just make sure everything on the monitors are going as planned.
Oh, Dr. Maitland, what are we doing now?
We're checking our patient, Miss Zane, over here. She just had a transplant in her heart. And we're just going to check on her vitals and everything right now. So, Miss Zane, are you feeling all right today? No.
It was intense. Like,
It was very intense.
But
But
very rigorous. And
yeah.
education required. I mean, we're halfway there. I mean, we're pretty much done as of in the spring when we graduate. But I mean, 10 years of training.
I know, it's a really long time.
Yeah, but I mean, the economic gains are fantastic, and
Yeah.
as well as just the patient care and the rewardiness of the career seems worth it. What do you think?
It really does, yeah.
So yeah, the transplant surgery seems like an excellent career despite it being as difficult as it is.